There. So this is a video if anyone's had mastectomy with an implant, reconstruction, possibly the implant's feeling a little bit tight. It's a few weeks after surgery and the scars are healed, but the implant's feeling a bit tight. You may have had radiation on top of the implant instead of an expander, which has caused the tissue to become even tighter and the implant to be a bit tighter. It can get to a stage where it's called capsular contracture, where it gets really solidly tight and not able to be moved, and that usually you need to go and see a lymphedema physio or someone like myself who does oncology massage and scar work that can help try and release that. But if it is just feeling, you can move it, but it's just feeling that little bit tight, then this is for you. So I'm going to manhandle my breast now, but I just want to show you a few techniques. So start off by, you're going to take your breast round in full range. So take the implant and take it into a full range, as far as you can sort of go comfortably, all the way around. And you're going to take some nice big belly breaths at the same time. Belly breaths sort of help move any lymphatics. If there's anything sort of stuck there, it'll help that lymphatic to move, but it also helps fascia to relax. Okay, so with the deep breathing of your belly, you're going to take your breast round in both directions, just nice and mindfully, not to cause any pain if it's too tender, all the way around. Okay, 2 to 3 times in both directions. So then you're going to take the breast into north, south, east and west, and with the breath. So you're going to take it, first of all, you're going to go hold your breath and lift it upwards, and then you're going to actually pull away the tissue and the rib cage just underneath, just traction it slightly away, just to create that little bit of fascial stretch there while taking some nice breaths. So you can hold it for 5 breaths, or even if you only got time to do 2 or 3 breaths, that's fine. Then you're going to hold your breath down. Now with this one, you're actually going to use a bit of arm extension as well. So while your breast is being pushed down, your implant is being pushed down towards your feet, you're going to just stretch away with the arm, and that's just going to help all of that sort of muscle and fascia around the pec, around the side of the lateral breast there. Okay, so you're still just holding the breath down, breath down, while taking some breaths and moving the arm away. Okay, so then you're going to take the breast into the midline. So you're going to pull it towards the midline of your body, and again stretching away with the arm, finding where you're feeling that, that feels tight there. So just stretching away, looking away with your head, put a little bit more traction in your neck and your pec there. So we're pulling the implant towards the midline of the body, nice breaths. Pulling away, hold it in the tighter spot while you take some nice big breaths. Now this next hold, if your implant is already falling away a bit further from the midline than the other breast, then you wouldn't do this one. You wouldn't pull it away and encourage more stretch to fall away from the midline. That's only if it's already fallen away a bit further than it should be, which sometimes I've seen happen. So if that's not the case, then this one's okay to do. So you're grabbing the breast and you're pulling it away from the midline. And with this one, you can move the other arm, just trying to get a bit of stretch through the sternum there, through the other pec. Big breaths while you're pulling away from the midline, straight laterally out. Okay, 3 to 5 breaths, whatever. All right, so it's just something you can do to prevent your implant from getting tight, at least 4 weeks after surgery, and also to help an implant that is already a bit stuck and adhered, just to help mobilize it away from the tissue on the chest wall. Helps keep it nice and free. Okay, give it a go. All right, thank you.